that I went to. It's been a bit of a busy week for me. I was at a Find a Cure workshop yesterday afternoon in London. That particular workshop is hosted by a charity called Find a Cure. They represent organisations like ourselves, small charities, trying to share information for how to succeed as a small patient group. The topic yesterday afternoon was how to secure European Commission funding for research studies for health. Now, I think that's probably somewhere along in our vision rather than our mission, which was very much that I learned. I think to participate in something like that, you have to have an idea on the table that you want to take forward. You also have to have collaboration with 3 partners in 3 EU partner states. So I think the key message that I learned out of yesterday was, yes, that's not right for us here and now today because we're nowhere near that position. But in order for us to move towards that tactically in the future, to put ourselves in a position to engage with more research, we need to collaborate more. And how do we collaborate more with other organisations that have a similar interest to us? And what organisations are there? Well, I think through networking with other people that were at the event who are a little more advanced than we are, I actually learned that what we need to do is engage with medical professionals that have a similar interest in the condition, that will perhaps like to work forward with us, with academics that are involved maybe in research, to also engage with other small charities, maybe small epilepsy charities, or even rare disease groups, because rare diseases is quite big, it's quite out there at the moment, and it's something that there's more funding going into. So perhaps it's something that we need to be starting tapping into and forging those relationships for the future. Lastly then, I'll give over to questions because I feel like I've been talking all day, so I apologise. The other exciting thing that we're doing is we've put together an article for epilepsy, which I believe has been accepted. So hopefully will be published sometime in the near future, and of course when that comes out we share that with everybody. Epilepsy, for those of you that don't know, is a publication that goes out to neurologists worldwide. So it's an article with a couple of family stories. It's personal stories about David and another family. Rachel Taylor very kindly was allowed to put her personal story. Carol, her mum, put that forward for us. So we've got 2 different Ring20 personal stories, and also some information regarding our new organisation and the fact that we want to engage with neurologists, we want to engage with other families with Ring20, we want to embrace them into our new organisation and build our patient group to be able to grow, because if we are a bigger group, we surely are stronger and we can take things forward, and we're a more powerful voice to take things forward for Ring20 in the future. So really excited about that, really looking forward to seeing that come out, and hopefully lots of new ideas going forward. Okay, that's plenty enough from me, sure. Had enough from me today. So now I'd like to introduce you to our lovely 2 guest panel for the day, if you like.